All right, welcome back. This is our second of 3 webinars this week featuring our hygiene team at Vestal Dental Associates. This week is National Dental Hygienist Week, and today we have Joan and Brittany with us, who started just about when I started. We're going into our 8th year at Vestal Dental, so welcome and thanks for hopping on today.
Thank you. Miss all you guys.
And we have Brittany Barber, who's been with us for 2 years, right? And we all miss Patty Carter. She was great, a great asset to the practice in terms of patient care, and a lot of patients still remember how well she took care of her patients. But I think Brittany did a nice job taking over a lot of her patient base, and it seems like you've been here longer than 2 years. You really fit in well. So thanks again for joining us today, Brittany.
Thank you for having me. Yep.
All right, great. So before we get into our frequently asked questions today, I just wanted to emphasize how the practice is functioning currently. As everybody is aware, and as I mentioned yesterday, per the ADA, per the New York State Dental Association, we are restricted to emergency care only, or urgent treatment, which is essentially emergency treatment as well. So the 3 doctors, Dr. Mike, Dr. Ray, and myself, are available for that. We are typically there. One of us is typically there in the morning each day of the week, and our emergency line is available as usual 24/7. So by all means, if you need care, please call the office. We do have a couple team members answering the phone, but that's pretty much what we're limited to at this point. As far as keeping the office safe, we are screening all patients that come in for emergencies. We're making sure that they haven't been exposed to their knowledge. We're making sure they don't have symptoms. We're taking temperatures, and we're asking patients to show up at the time that they're scheduled, possibly waiting in their car if they're early, just to avoid contact with other patients. So that's pretty much our protocol. The doctors are here for an emergency that you may have, and we hope everybody is staying safe and healthy, and helping contribute to keep this spread as low as possible. Okay, you guys ready? We got some questions here. So today's title is How to Help Your Children Maintain a Healthy Mouth During COVID-19. First question is, what are some things, and this is similar to yesterday, that we can suggest to parents in order to help children maintain their oral health when school is closed and they are out of their normal routines, especially when they may have access to snacks throughout the day when they are otherwise learning in school?
So it might be slightly chaotic in your household because schools are closed and we're not able to go to work because of COVID-19. But we must do our best to stay on our daily normal oral health routines. When we start to slack off or become forgetful of our oral hygiene, that's when tooth problems arise. So we recommend our children to brush twice a day for 2 minutes, once after breakfast, right after breakfast, and once before bed. We also highly recommend flossing as well, once daily. I know dental floss, wrapping it in your fingers and trying to go into your children's mouth might be a little difficult, so the floss holders come in handy. They're very efficient and they're easy to use. And also rinsing with mouthwash is really helpful. An anti-cavity mouthwash like ACT or children's Listerine helps really well. And like Dr. Robinson said, snacking is huge because kids aren't in school, so they have access to all this food. So healthy snacks include cheeses, fruits, vegetables, crackers in moderation. If your child wants cookies or candy, just try to limit those. Have them eat it in one sitting so they don't continually have an acid attack, it's called, when the bacteria feed off those sugars and create acid that essentially destroys the enamel, and which creates a cavity. And we don't want that to happen over time when we're eating all those sugary stuff.
Yeah, that's great advice, sure.
And if they are eating cupcakes and ice cream and all that good stuff, have
stuff
them
that tastes good
water right after.
Yeah.
Because when you're drinking water, it washes all that sugar off your teeth. So it's not sitting there creating all the acid and destroying the enamel.
Yeah, good. Joan, I know you have some little ones at home. Anything to add to that?
I do. I have a 2-year-old and an almost 6-year-old. Our new routine is brushing kind of mid-morning because we don't really have anywhere to be. So it's kind of like there's 2 breakfasts. There's first breakfast and second breakfast. So brushing after second breakfast, which is usually around like 9 or 10 in the morning, that's been helpful. The snack attacks are crazy, constantly getting snacks all the time, and limiting sweets to the meal times, like right after lunch if they want a treat, because they're stuck inside, don't have the fun things to do that they do at school. The other thing that I find useful as far as the little ones go is to put on a song during cleaning their teeth. So if you have an Alexa or even your phone or just anything that plays music, those little kids' songs are really helpful.
That's a good tip.
So that's what we've been doing.
That's a good segue to our next question is, what are some tips that can help parents establish a good oral health care routine for their children?
Joan, you want to take this one?
Sorry, I didn't know it was going to start. Can you say it again, Dr. Robinson?
So what are some tips that we can give parents to help them establish this routine? Just kind of getting the kids used to doing this. I mean, obviously you mentioned the songs and finding a time, that would work better for them. Any other tips that you can share with parents in terms of establishing the routine?
Find the new normal, I guess. That's what we've been doing. You have to adapt to what's going on. We usually brush before we get on the school bus in the morning. So now that's not happening. So you just kind of roll with it depending on how many children you have and how their age groups and things like that. I guess that would be my main thing. Find the new normal.
Yeah, find what works. Try and establish some type of.
And stay with it. Stay with the brushing in the morning. That's really important, even though we don't have anywhere to be.
Yeah. The next one we had was, why is plaque accumulation so helpful or so harmful? And what are some signs that home care may need to be improved for our children?
So like I said, when bacteria accumulates, the colonies of bacteria that create acid, that destroys the enamel. And when plaque typically accumulates, it accumulates around the gum line. So we have to pay extra attention when your children are brushing. They want to go up around the gum line. Typically plaque is colorless. It can be yellow. If you look, it will show up on your children's front teeth because they are always missing that area. And it not only causes cavities, but it causes gingivitis, which can be very painful for your children. I typically find when we are flossing children's teeth, they are a little bit sensitive when we go up along the gum line. So we want to pay extra attention to that area. And it might feel fuzzy to them when they're rubbing it with their tongue. So that's another sign of that plaque's accumulating.
Mm-hmm.
And yeah. So.
You mentioned they miss the front teeth or along the gum line. Is that so? Are you saying that kids tend to just brush in the back and think they're doing a good job?
Brush right in the back. They just kind of zoom right over the front teeth, and that's it. It just that's the most popular spot that they miss.
Yeah, I agree.
Because I tend to brush, really good in the front, but kids just miss that spot right in their front teeth.
Yeah.
Sorry, go ahead.
Yeah, I was going to say, obviously you'll see that same signs as that you see in adults is, bleeding gums, especially when flossing or even brushing sometimes. So that'd be one sign to look for, and that filmy type appearance on the teeth, like Brittany was talking about. Yeah.
A couple things that I noticed are, like you said, bleeding gums, kids with smelly breath. Yeah. You hear that a lot from parents, and that's a sign that it's usually in the morning, and that's why brushing in the morning is so important in flossing. The other thing is food getting stuck in between the teeth. You know, if they keep pointing to a spot, or my son will go grab a flosser and do it himself now, but not every kid's going to do that. So if they're saying something, you know, is stuck, or popcorn or something, because my kids are addicted to popcorn right now, I would say those are a couple signs to go in the bathroom and clean teeth.
A lot of kids do have those natural spacing because because of the size of the baby teeth. So it's obviously a normal to have some of those spaces there, and then food can obviously get caught in those if we're not cleaning.
Correct.
Okay. So the next one we had was, should children be using a certain toothpaste or mouthwash to help them prevent cavities?
I guess I could take this one. So I have some things set up to kind of go over the different options of what you can use. And these can all be picked up at stores or Amazon, all those things. So I guess we'll start with flossing, because I recommend flossing first. This is the water pick. And then we have the regular floss, which is Glide, which is what we use in the office. And then we have the handheld flossers, which Brittany talked about earlier. So those are usually the three options to start with. And then we have a kid's Oral-B electric toothbrush, an adult electric toothbrush, and then some manual ones going from adult to child, then to baby. So you can see the size difference and how it can clean the teeth better. The next thing is toothpaste. So I'm not sure if you can make out the words on it, but the one to the left is a kid's fluoride toothpaste. This is one that they spit out and can prevent cavities. And the next one is a fluoride-free kids toothpaste. The next one is a baby's training toothpaste. It's safe to swallow, and it has no fluoride in it. And then we have just the regular Crest Mint, more kid adult toothpaste. Last step would be mouthwash. So this is a alcohol-free natural fluoride rinse. It's strawberry flavored, kids like that. Or you have a regular Crest, no alcohol, with fluoride mouthwash. So those are kind of the options that I would say that we use in our house. I don't know if that's helpful or not, but.
Yeah, absolutely. So at what age does each child kind of progress to the next step, or is every kid different? Obviously that could be.
I think it goes by the size of their mouths and also how many teeth they're getting. So my little one is now getting his 2-year molars, and we're still using the baby toothbrush, but I'm about to graduate him to the kids Oral-B toothbrush, and the toothbrush heads come on and off. So him and his brother can both use the same one and just have different toothbrush heads. So we're approaching that here very soon. So I would say that the size of their mouth and how many teeth they're getting.
So the other question I thought of was fluoride. There's a lot of controversy around fluoride. Obviously, our practice is a proponent. But I guess what are some signs that show that kids are able to tolerate fluoride, or if they're ready to start using that?
I think the toothpaste and the rinse are the two things that are questionable and when to use it. I would say when they can spit on their own and they can demonstrate that they can brush their own teeth and they understand, you know, how to do it. The other thing with mouthwash is we just started to do that with my older one because he's almost 6. So they usually say around 6 is the time to start it. I think you have to go by your own child at the same time. And just to make sure they're not going to swallow it. Fluoride is safe. It prevents cavities. It's very effective. You just don't want to ingest it. You just have to spit it out. It's just a topical application.
Yeah.
It does a lot of good.
Brittany, anything to add to that?
Yeah, just like Joan said, when they are able to spit and rinse out real good, and I think that's a sign that they're ready to have some fluoride, because it does help. I know a lot of patients' parents, they decline fluoride sometimes because they think they're ingesting it, but they're not ingesting it. It stays on their teeth. It's absorbing into their enamel, and afterwards, when we're done applying it, they spit right out into the bowl. And so spitting and rinsing is a good.
It's a sign. Yeah, good. And that kind of leads us to our last question: is what if my child has orthodontics? Are there special considerations, since many orthodontic practices are closed? specifically in terms of keeping the teeth clean around the brackets?
If your child has orthodontics, brackets, braces, retainers, spacers, whatever, the electric toothbrush is great to use. It basically does all the work for you. It's much better than a manual toothbrush. It has a timer on it and everything. Depends on what. That one.
All right.
And then like Joan showed you, a water pick is really helpful. I know it can be tough getting, yes, that one. There's also one that sits on your countertop.
I'm not gonna turn it on.
Because it literally flushes all that bacteria and all that food debris that's getting caught in those brackets out from underneath. And it also helps with the gum line, like I said, with that plaque accumulating on the gum line, it flushes that from out underneath there. And when kids do have braces, they tend to get some decalcification, which is thinning of the enamel. So when that enamel thins so much, a cavity can happen. So water picking, electric toothbrush, brush more than twice a day.
Yeah.
All the
I'm
time.
sure they're hearing that from their orthodontist as well. But hopefully it's something that while they're not able to function like us, that we can kind of drive that home to parents and the kids that can control that. So Joan, anything to add to orthodontic patients at this time?
I do, yes. Being an adult going through ortho myself, I think it's just all orthodontic patients, because sometimes adults aren't the greatest at keeping their teeth clean as well. So I think if you have orthodontics, it's the main thing is just more home care. You have the time, you're ready to sink. You're not at school, you're not at work, you're not in front of people. So really just more home care, like Brittany said, the water pick, the electric toothbrush. One even like this is like $30 at Walmart. Okay, it doesn't have to be like $100 toothbrush. Okay, so they are affordable and they work really well. Water picks can be purchased through Amazon if people don't want to go to the store. They're very, very helpful, especially in a time like this. Those little interproximal brushes are great. That's pretty much it. We just don't want you to come back with a bunch of cavities and gum disease. We want you to stay healthy.
Yeah, unfortunately, we do see that sometimes when patients have been in orthodontics long term and they come out with a beautiful smile. But if they don't do a great job keeping the teeth clean, then we end up doing a number of fillings afterwards, and the smile isn't as beautiful as it could be if they kept those clean. And I know, talking about orthodontic practices being closed, I did speak to a couple of the local specialists around the area, and they are able to see patients if there is an emergency. You know, if the wire is broken or the bracket's off and it's really irritating. My advice would be to call the office, and I'm sure there's a way to get into touch with them to see if they can, if it's something they deem necessary to treat or meet you in the office for.
One other quick thought I have about the ortho, especially for Invisalign too, which is what I did, to be cleaning out the retainers.
Yeah,
you know, at nighttime, and keeping those clean as well, because they tend to harbor a lot of plaque and stuff like that. So that was the only other thing.
Yeah, great. Well, I just wanted to thank both of you for taking your time out of your busy schedules during all of this. And hopefully our patients with children, or even children that are watching this, can get some tips to kind of take care of their teeth during this time that we're unable to see them. And like I mentioned yesterday, to stay as healthy as we can, so that if we did get exposed to well, anything but coronavirus, that we're able to fight it off as best we can. So oral health care is just as important as anything else. And I just, again, thank you guys for joining us.
Thank you very much, guys. Just remember, health begins here. All right, guys. I'm with you.
Yes, see you later.
Bye.